I've been doing both threads and fillers for several years now, and one of the most common questions patients usually ask me is, what is the difference? What can threads do that fillers can't do, and what can fillers do that threads can't do? So we usually use the threads for lifting and fillers to replace volume. Most people need both of those. When you age naturally, you start to lose volume in your face in addition to developing muscle and skin laxity. Like for example, in the cheek, over time, people start to deflate in their cheek, and then all of this starts coming down, and you'll get folds here and then get folds in this area. You use threads to kind of pull this back a little bit, and that's the lifting effect. And then you use filler to fill up the volume loss and creates a little extra support and scaffolding for the threads. This video is just going to be about the difference between threads and fillers and the combinations of threads and fillers. But if you want to learn a little bit more about the threads, there's a little description box below this video that has links. In regards to discomfort, they're pretty comparable. I mean, fillers are a lot quicker to do than threads are. And we use different ways to inject fillers. We either do it with a needle, which usually means placement deep on the bone, or we'll use a cannula when we go a little bit more superficial. With threads, you have to place them under the skin, and we put numbing into the areas where we're going into the skin with the threads, and that makes the thread procedure fairly comfortable too. Downtime with filler depends on the individual and the area where you place it. Some people just swell more than other people do. For example, deep on the cheek, most people don't swell that much. Lips, people swell a lot. Threads, people tend to have a little bit more downtime with. You will have some more swelling there. You do have an increased risk of bruising there too. We do have ways to treat the bruising with a laser that kind of breaks down the bruise faster. I always tell people that for 2 weeks they have to take it a little easy when they put in threads, because you don't want to have a lot of movements in the area, so the threads have time to settle in. With filler, usually after 24 hours you're fine, you're good to go. In regards to pricing, fillers tend to be more moderately priced than threads for most people, but it really depends on how much filler and how many threads you need. Most people tend to be better off by doing a combination of both, because I find that with aging, most people have both. They both have volume loss and skin and muscle laxity. However, occasionally there will be somebody who is better to just have volume replacement with filler, or just have threads to lift.